Hi there, my name is Stephen Beard, and I'm one of the licensed psychologists here at Children's Program. If you're watching this video, it means that you've already spoken to one of our intake specialists on the phone and you're getting ready for your initial consultation. We are so excited to meet with you. There are just a couple of things we want to get ready and anticipate for that appointment. So first off, there's some paperwork that needs to be done. Ideally, that's done a week in advance and completed and submitted through the lobby paperwork portal on our website. This is really important for us as providers because it allows us to be able to get all that extra information, all that background information that we need to be able to hit the ground running during that initial consultation. It's no fun if you feel like you have to repeat yourself and say things that you've said over and over to different providers, and it's a lot easier for us if we're really able to focus on the most specific presenting problem and concern that you have. So please get that paperwork done in advance. Those initial consultations happen two different ways. Sometimes we meet with you in person, sometimes we meet with you virtually. If we're meeting with you in person, great. We just ask that you get here about 15 minutes early so that you can check in and get set so that we can hit the ground running right at the beginning of that scheduled appointment. If we're meeting with you virtually, that means that we're going to be sending you a link to attend that meeting. That's through Zoom, so we ask that you have Zoom ready and downloaded on whatever platform you're going to use, computer, tablet. We just want to make sure that you attend that appointment in a private, confidential space. Ideally in your own home, but certainly not somewhere like a coffee shop where not only is there going to be lots of noise, but we can't necessarily guarantee your privacy. That link, again, might be something that your spam filter kind of pushes out of the way. So just make sure that you're looking through your spam folders if you're not seeing that link. This is an initial consultation for parents, right? We love kids, that's why we're the children's program, but this initial consultation is reserved for parents to be able to voice their concerns and share their observations. So please make this a parent-only appointment, and ideally all parents are present. So especially if there are two households, we want to make sure that all caregivers are included in this conversation, but also we sometimes see different things from different parents and different things from different households. So if at all possible, please have all caregivers with us that day. Over the course of that evaluation consultation or therapy consultation, we are trying to decide what makes sense for next steps. If that's for therapy, it means that we want to develop treatment goals and we want to think about a possible timeline for what to anticipate. Is this going to be 6 to 8 sessions, 8 to 10 sessions? And this is something that you as the parent are going to need to be really active in deciding. We want to hear what your goals are. We have our ideas, but we really want to hear yours as well. Sometimes you've already talked with our intake team during that initial intake discussion, and you have a few extra sessions scheduled, and that's great. Sometimes maybe that wasn't a good time to schedule, but now we really do want to get some dates on the calendar. So please be ready to do some scheduling at that time, especially if it's for a therapy session or for therapeutic intervention. So get that paperwork done, get there on time, parents only, be ready to talk about treatment goals, next steps, and be forthcoming. And we can't wait to meet with you. Thanks so much.